Hello. We're going to talk about anaphylaxis. This is my elderly dog, Toddy. He's a rescue. And yeah, he's an old boy. He's living his best life, though. So, we're going to talk about anaphylaxis, and I'll share my story of anaphylaxis here in a bit. But let's just talk about allergic reactions in general. There's a spectrum of allergic reactions, and the first one is just a skin reaction. So that's called an allergic reaction. And you might have that after you got stung by a bee. You just have a little bit of local itching, meaning it's just in one area, or you try a new laundry detergent and your skin itches a bit. Not a huge deal. The treatment for that is Benadryl, correct? You just take it as it says on the container. Do not take more Benadryl than it says. So you can take that. They make liquid form for children and they make pills for adults. And so that really works for the itching part. And so your body had contact with something that it didn't like. That's called an antigen. The body reacts to that. The immune system kicks in to try to fight it and deploys antibodies and histamines to fight it. Now, some allergens will stimulate an allergic reaction and others do not. So you'll just never know until your body comes in contact with it. And then some reactions are local, meaning just in one area of itching or symptoms, and then others are systemic, meaning your whole body breaks out with some itching. Along with the itching of an allergic reaction is hives or urticaria. So that is the little red bumps that are itchy, and that's pretty common. Now, other symptoms of minor allergic reactions are a runny nose, itchy eyes, um, watery eyes. Those are all things that are, again, sort of skin related types of things. And Benadryl is the best choice for that. Now, if you're sensitive to Benadryl, it does cause drowsiness. And some people rarely have an opposite reaction to the drowsiness and they get super wired. That's called a paradoxical reaction. But if you're sensitive or you can't get, ooh, I'm getting bit by an ant. If you can't take it because you need to stay more alert for whatever your situation is, you can use another medication. Hold on, I'm going to look exactly what it is. Allegra. Allegra is an antihistamine that can work for this situation. You would take 60 milligrams for an adult. Now, the next stage of allergic reactions is anaphylaxis. Now, in anaphylaxis, that is, we're working towards a life-threatening situation. Anaphylaxis is more of a full body systemic reaction, and it impairs maybe airway, breathing, circulatory status. And certainly when we get to circulatory collapse, that's a shock state, poor perfusion to the brain. And that is a type of distributive shock. We have the fluids of the body distributed into the wrong areas. The blood vessels open up, become permeable, lose fluids, and are floppy with relative hypovolemia. Refer to the shock talk about that. And that is a true life-threatening situation because you are in a shock state and potentially a progressive or hypotensive shock state. Now, in anaphylaxis, we start to get constriction in the lungs, and so that is called bronchoconstriction. We have some vasodilation. That's that widening of the blood vessels. The blood pressure starts to drop. The capillaries become permeable, meaning that fluid is leaking out. We start to get puffy hands, puffy face, puffy feet, things like that. And we start to get some mucus production as well as part of the immune system trying to manage what's going on. What are some of the causes of this? Well, I already talked about laundry detergent or a bee sting, an insect sting, something like that. Also, we could have interaction with a jellyfish. We could have food. Most common situations are foods or medications, Benadryl, penicillin, and other antibiotics, shellfish, and dyes that are used in CAT scans and other exams can cause these reactions. Now, with these, we can also have environmental triggers like the laundry detergent, pollens in the air. That's chemicals. The pollens don't normally cause anaphylaxis. They do cause a lot of systemic itching and watery nose and things like that. Watery eyes, itchy nose, itchy eyes, runny nose, but generally not anaphylaxis. And then latex or rubber. Often we learn that it's the powder inside the latex gloves, not the latex themselves, but some people do have latex allergies. So we sort of talked about the progressing signs and symptoms. As the anaphylaxis kicks in, we might have bright red skin, the hives are worse, the itching, swelling, anxiety, restlessness. This is a scary situation. Heart rate starts to go up pretty high, start breathing faster, having a little trouble breathing, maybe wheezing. That's the high pitched noises, maybe stridor. So on the inhale, the high pitched noises is stridor. On the exhale, high pitched noises is wheezing. That's swelling inside the throat and tightening down of the bronchioles inside the air passageways inside the lungs. All these not good. So we need to take care of this as soon as possible. So what is the treatment? Well, treatment number one for anaphylaxis is epinephrine, not Benadryl. So Benadryl helps the itching, and epinephrine helps the anaphylactic situation that's going on. So this is my own Benadryl, or my own epinephrine pen, and I just got this about, I don't know, a couple months ago, and it expires in just a few months from now. So the expiration dates on these are not long at all. Excuse me. And these are kind of expensive, especially if you don't have health insurance. Now, they are starting to make these. It's called a Neffy, and it looks just like Narcan. Psh, you just squirt it up the nose. This guy has a needle in it, and they're very expensive, and they expire quickly. This one, no needle. I don't think it expires as fast, and it's super easy to use. Also by prescription. In this country, you can only have epinephrine if you have a prescription and a history of anaphylaxis. Sounds crazy to me. I really feel like this should be part of a first aid kit, just like Narcan, because you can't really overdose on this. Yes, you can have some problems if you get too much, but this is going into the muscle. This one's going into the nose. It's not like we're giving it through the IV that we do that in other situations like cardiac arrest in the healthcare setting. But if we get too much of this, then we're just wired and anxious. Might have some blood pressure problems, especially in the elderly. But really, there's no reason that this could not be an over-the-counter medication for our first aid kits. It's literally life-saving. The reason that people die in anaphylaxis and anaphylactic shock is a lack of epinephrine given by healthcare providers. That means paramedics, EMTs, nurses, and physicians in the hospital. We don't give it soon enough, and we don't give it repeatedly or often enough. So this is a medication that needs to be given as soon as we suspect that there is an anaphylactic reaction. When would we suspect that? Well, symptoms of shock, swelling in the face, trouble breathing, itchiness, and a probable interaction with something, some sort of antigen like a new medication, a new food, peanuts, a sting by a jellyfish or something like that, by a bee. Okay, so we're going to go over in class how to use this and practice with it, but essentially the instructions are right on it, and this is a single dose. Most people who have anaphylactic problems carry 2 of these, and I also carry 2, but this right here is 1 dose. They also make this for children. It's called EpiPen Junior. It's just a little bit smaller dose. Now, where do we give this? Well, we give it ASAP in the quad only. So where we're going to give this is in the middle of the quad. So hopefully you can see my leg here. So here's the quad. This big muscle right here, I'll try to make it bigger. That muscle is what we're going for. This is an intramuscular into the muscle injection. So I would take the cap off of this. I would take the safety off of this so it doesn't go off in my backpack. And then I'm going to go through Carhartt, ski gear, jeans, or right into the skin. And I'm going to slam that right in there with some pressure behind it so that the needle can push down into the quad. I'm going to hold it there for about 5 to 10 seconds. Woo, man, these, excuse me, sorry, these ants are rough. I'm going to push that down, hold it in however long it says, generally 5 to 10 seconds. And then I can pull it off. The needle will be have a safety put over it, so you can't get hurt with that needle. Now, if the person is obese, you might want to give it a little lower where the quad muscle has less fat. And that's okay. We just still want to be in the muscle. If they're super duper obese, you may want to go down here into the calf. But for almost everybody, you're going to be going in the middle of the quad in that big muscle the vastus lateralis. Whew, okay. Maybe I'll have an allergic reaction right here to this, these ant bites. Jeez, they're massive ants and they give a good bite. All right, so treatment number 1 is the epinephrine as soon as possible and repeat it as necessary. How soon do we repeat it? Well, if it didn't work in about 10 minutes and you have a second dose, you're going to give the second dose. Don't be scared to give it. We want their symptoms to be nearly resolved. So the swelling won't go down, but you'll see a little bit of an improvement. Their breathing should get better. Those high-pitched breathing sounds should diminish. Their itching may get better, maybe not. And when I had my allergic reaction, I took Benadryl at home and then went into the hospital. The Benadryl did absolutely nothing for my itching when I was anaphylactic. When I've had other itching situations, when it was just a minor allergic reaction, the Benadryl works great. So treatment number 1, as soon as possible, epinephrine, and then repeat as needed every 10 minutes until more help comes, as long as you have epinephrine. Now, if you have Benadryl, yes, that's helpful and you want to give that. Again, that's for the itching and the skin reaction, which is also uncomfortable. That's not going to help true anaphylaxis, but it might help with some of the symptoms. So again, same dosing as it says on the bottle for adults or for children. Try other medications that decrease the histamine reaction in the body is a H2 blocker. Now, Benadryl and Allegra are H1 blockers and histamine. H2 blockers, histamine 2, that can be brought down the reaction that's happening with Pepcid. That's the best one. So 10 to 20 milligrams of Pepcid, that's an over-the-counter medication. It is a stomach medication. It deals with the histamine receptors in the stomach, but in this situation, we're using it for the histamine reaction that's going on systemically. And then obviously, if we're pulling out an epinephrine pen, we need to call 911 and plan for evacuation. If the patient is really in a bad state of anaphylaxis, your 1 or 2 doses of this is not going to sustain them long enough. Okay, it's just going to get them through until you have a helicopter who comes to pull them out, or the medics show up, or we get them to a hospital. Now, in our live course, I will also show you when you break this guy open, there are actually about 2 more doses inside there. So this automatically shoves 1 dose, it bulldozes the dose down into the muscle. But if you break this open with like a hacksaw or a hammer or whatever, you get very carefully get in there. There's a needle in there. Very carefully do that, or have the person do it themselves so they are the one touching the needle. Again, there are about 2 more doses in there. So potentially, if you had 1 of these, you have 3 doses. So every 10 minutes, that's 30 minutes. And if you had another one, now you're up to an hour to help sustain till treatment can get there. We can get the person evacuated out. Again, in the live course, we will go over that a little bit more in detail. So what else? They're in a shock state potentially. So all the same things as far as a shock state. We're going to keep them flat. We're going to keep them warm. We're going to try to keep them as mellow as possible. And my gosh, I forgot the very first thing before even the epinephrine. Get rid of whatever the antigen is if possible. So that might not necessarily be a possible thing, but if you know what it is, remove the antigen. And of course, if there is true ABC problems going on, we're going to deal with those while looking for a dose of epinephrine. So I think we got the most of that. Quick review of this: 3 stages of allergic reactions. Allergic reaction where it's basically just skin, itchy eyes, urticaria or hives. We take Benadryl for that, as it says on the packaging. If we're moving into facial swelling and cardiovascular collapse, that's anaphylaxis and anaphylactic shock. The first treatment, ABCs, as always, get rid of the antigen if possible. Epi as soon as possible, repeated every 10 minutes as needed until those life-threatening symptoms start to abate. And Benadryl can be helpful. Other things that can be added in: a bronchodilator, which is the albuterol inhaler. Prednisone will help if you have a couple days till you can get somebody some help. And Pepcid would be another one to carry in an anaphylaxis kit. All right, I'm gonna get out of here so the ants stop eating me, and I hope you have the greatest day. Thanks for listening.